stool and
Pale stool. Okay, very
yeah.
good. For 16 day, what is the age of the baby?
Yes, also 16 days old.
So jaundice after how many day is dangerous?
14.
14 day.
After
Yeah.
2 weeks.
For a term baby, jaundice after 2 weeks is dangerous. For a preterm baby, jaundice after 3 weeks.
51 days.
Yes, 3 weeks. Right, very good. What is the other point in favor of this case, biliary atresia, to you? What is the other points in favor? Stool color. Another is stool color. Stool color is pale. That means it is called alcoholic stool. Alcoholic stool, pale stool color, right? Abdomen is soft, non-tender. So it is not celiac disease. And celiac disease will not be diagnosed at day 16.
Yes.
Okay. So your diagnosis is biliary atresia. Very good. So now tell me, what makes normal stool color brown?
Sarcobilin.
Sarcobilisonin.
And what makes urine color brown? Or
Urobilinogen.
Very good. So urobilinogen and starcobilinogen, or you can say urobilin, starcobilin. These two are the product that causes yellow coloration of our stool, of our urine. Now tell me, stool become alcoholic. What will be the color of urine in biliary atresia?
Dark.
Dark yellow.
Dark yellow. Why? Why dark yellow? Why not pale? Why dark?
Madam, there is a biliary obstruction. No starcobilin is passes out and except enterohepatic circulation, and more urobilin is passed out through urine. So increase urobilin in urine, so there is a color dark. And absent of starcobilin in stool, this is pale. কিন্তু মানে একটা কোশ্চেন আছে এই প্রশ্নে ম্যাডাম।
Yes, this question came in
Biliary
exam.
atresia তে ম্যাডাম শুধু পেল স্টুল কিন্তু আদারওয়াইজ বেবি নরমাল। এটা তো
No. Baby is not so normal. Actually, in biliary atresia and neonatal hepatitis, if you compare between the biliary atresia and neonatal hepatitis syndrome, which baby is more sick? Neonatal hepatitis baby is more sick. Biliary atresia is not so sick looking, but they also have failure to thrive. They have, this fatty stool, greasy stool. They have pale color stool. Okay, pale stool, alcoholic stool. And what is the mechanism of this dark urine? I'm telling you, fat is not coming, bile is not coming to the second part of the duodenum. See the picture. See the picture here. This is the liver. This is the liver, right? This is the gallbladder. This is the gallbladder, right? This is the gallbladder. And this is our second part of duodenum. This is the channel. This is the channel that is coming from the gallbladder. And this is called sphincter of OD. Sphincter of OD, right? There is a sphincter. Here, this is a block. This area is blocked. Congenital biliary atresia, this channel is blocked. Gallbladder is hypoplastic. These channels are hypoplastic. So the bile cannot come into the second part of the duodenum. Am I correct? Hypoplastic gallbladder. These channels are all hypoplastic. That is the name of extrahepatic biliary obstruction. After the liver, all the channels are blocked. But in the liver, inside the liver, there is hepatocyte. They produce bile. This bile is metabolized inside the liver, become unconjugated, right? The bilirubin, unconjugated form. This comes into the blood. Why? Because there is blood circulation. So excessive unconjugated bilirubin will come into the blood. In the blood, it will form as urobilin. So as there is no bilirubin here in the second part of the duodenum, all the bilirubin is going to the blood and forming the urobilin. And this urobilin makes the urine color more dark. Yeah, because whole the liver, there is anastomosis between the hepatic artery and the systemic artery. There is anastomosis. Okay, this anastomosis makes all the bilirubin comes out of the liver and they cause dark urine. Normally, urine is not so dark. Okay, so this is the reason of dark urine because the channels are blocked. All the urobilin is going to the blood. Am I correct? So
Yes.
remember, starcobilin makes it stool color yellow and urobilin makes urine color yellow. So in the biliary atresia, the stool is white, chalky, because of the absence of starcobilin, because there is no bile in the stool. Now, breakdown of hemoglobin. I told you there are some basic anatomy that will definitely come in your exam. Among them, one is bilirubin metabolism. For example, so bilirubin metabolism, when any blood cell break down, any RBC, what happens? There is a production of heme and globin. Heme and globin. Globin is amino acid, goes into the amino acid, but heme is breakdown again. There is iron, 4 iron chain, right? And there are other iron and bilirubin production. And this bilirubin goes into liver. There is metabolized unconjugated bilirubin. Okay. And it becomes conjugated into the hepatocyte and comes out with the bile in the second part of the duodenum. In the second part of the duodenum, there are many bacteria that causes metabolize of that conjugated bilirubin into starcobilin. Okay, this is the process of hemoglobin breakdown. Heme and globin. This heme has iron and bilirubin, or you can say bilivardin. There are different mechanisms from bilivardin to bilirubin, from unconjugated to conjugated. Who makes our bilirubin conjugated? Liver. By which enzyme? Can you tell me which enzyme?
Glucuronide transferase.
Yes, glucuronide transferase enzyme. So that is the last enzyme. If you have less enzyme, you will have more jaundice. In which disease? In which disease there is abnormal glucuronide function, abnormal enzyme function? Gilbert. There is abnormal bilirubin, abnormal enzyme function. So for Gilbert syndrome, which drug we give to increase this enzymatic activity?
Phenobarbital.
Phenobarbital. Aiva. See, one question is related with other question. It is just like a, just like a beads. It is just like a beads of a mala, of a necklace. Just like a beads. One question give rise to another question, give rise to another question. So if your knowledge is just like a bead, like this, you will never forget in your life. But if your knowledge is just like this, chara, I mean, there is no relation with one another, then you will forget easily. Okay, did I make you understand what I'm meaning? I'm meaning that when you read anything, you have to connect it with other thing. When you read bilirubin metabolism, you have to connect it with Gilbert syndrome. You have to connect it with the treatment of Gilbert syndrome. And this is your TAS exam. There will be a question that which one of the following is a rate limiting enzyme for bilirubin metabolism? This is the rate limiting enzyme. Okay, glucuronide transferase. This is the rate limiting enzyme in bilirubin metabolism. So how many questions we read today? Many questions related to our TAS exam, right? Okay, now. Sorry. Okay, now this is the answer. Okay, this is your answer.